What do you have there?
A cigarette?
Yes, a cigarette. What do you think this is?
So you're smoking like 5 packs a day, huh?
How do you know that?
Don't you realize what smoking is doing? It's increasing your chances of COPD.
What's CO? Are you in Colorado? Or are you, is it cheeseburgers of the day? 'Cause I'm a little hungry.
COPD. I mean, don't you see what you're doing to yourself? Like, people used to think smoking was healthy and all good, but I mean, until it didn't kill anyone, but now it's actually killing people. And you know, if you smoke a lot, then you're gonna start getting like chronic diseases like asthma, bronchitis, or all those together. COPD.
You know, I've been smoking for a long time now. It's gonna take a lot more convincing.
Alright, let's show you what COPD is.
Are you serious?
COPD, chronic obstructive pulmonary disease, is what makes it difficult to breathe over a matter of time. It can cause coughing that will produce lots of mucus, wheezing, shortness of breath, and chest tightness. So there are 2 common types of COPD, known as emphysema and chronic bronchitis. Emphysema is where the alveoli at the end of the smallest air passage, known as the bronchioles of the lungs, are destroyed due to the exposure of the cigarette or exposure of smoking or any harmful air pollution. And second is chronic bronchitis, is inflamed of the bronchial tubes that carries air back and forth from the alveoli of the lungs. What are the risk factors? Smoking is one of the number 1 risk factors of COPD. There are other risk factors which include the air pollution, secondhand smoking, genetics, or working with dangerous chemicals. And the complications is having COPD means it can cause a lot of other complications as well for the individual, such as respiratory infection, lung cancer, heart issues, and even depression. So the question, is there a cure to this? Is that there is not, but there are treatments that can be given from a physician that can slow down the progression as the individual gets older and help the symptoms. Some fun facts is that COPD is the 4th leading cause of death in the United States, and about 16 million people are diagnosed with COPD. And not a lot of people would know they would have it until they are diagnosed.
Doctors will diagnose COPD based on the patient's signs and symptoms, their medical and family history, and test results. The doctor may ask whether they smoke or have had contact with lung irritants such as secondhand smoke, chemical fumes, or dust. The test that a doctor might ask a patient to do is a pulmonary function test. Pulmonary function test measures how much air you can breathe in and out, how fast you can breathe air out, and how well your lungs deliver oxygen to your blood. Other tests that your doctor may recommend are a chest x-ray or chest CTs. These tests create pictures of the structures inside your chest, such as your heart, lungs, and blood vessels. The pictures can show signs of COPD. They also may show whether another condition such as heart failure is causing your symptoms. And an arterial blood gas test. This blood test measures the oxygen level in your blood using a sample of blood taken from an artery. The results from this test can show how severe your COPD is and whether you need oxygen therapy.
According to Mayo Clinic, the most common treatments include smoking cessation, which keeps COPD from getting worse, a wide variety of medications, such as bronchodilators for relaxation of the muscles around the airways, inhaled steroids, which reduce inflammation and prevent exacerbations, combination inhalers, oral steroids, roflumilast, a phosphodiesterase 4 inhibitor, and other antibiotics that alleviate respiratory infections, such as acute bronchitis, pneumonia, and influenza. Lung therapies, which are used for people with moderate or severe COPD, like oxygen therapy. And lastly, in the worst case scenario, a doctor might suggest lung surgery, which might be necessary to improve breathing. Though COPD can substantially compromise a person's lifestyle, it isn't incurable. With a strong will and the proper treatments, COPD can be overcome, and eventually, a person with COPD will be able to breathe better, have less exacerbations, and do more of the things that make them happy, which, in my opinion, is the best medicine.
Colorado, or is that?
Hey! You are so good.
Yeah, this is a cigarette. What do you think this is? What's happening to me? Oh, hey.
Yay!
Let's improvise.
It's doing to you, you're increasing your risk of COPD.
What's yo? Are you going to?
Me like that. 5 packs a day, huh?
Don't you realize what smoking is doing? It's increasing your risk of COPD.
I didn't say my line.